Today I will be discussing croup, which in its most simplest form is an infection of the respiratory tract. This video will provide a brief overview of croup, the causes, symptoms, treatment, and an evidence-based approach for treating this condition. Croup is often described as being a caregiver's nightmare. It is also known as acute laryngotracheobronchitis. It results from an inflammation in the upper windpipe and affects the larynx, trachea, and bronchi. This condition has a characteristically sudden onset, occurring at night or during the early hours of the morning. It affects patients when they are at their most vulnerable. It is mainly prevalent in children aged 6 months to 3 years, but it can also affect children of all ages, and even adults. Let's take a look at some of the causes and symptoms. There are many causes, the main being viral infections, such as parainfluenza type 1 and type 3. Although this is the main cause, there are also others, including influenza A and B, measles, respiratory syncytial virus, and even common asthma and allergies. Croup can also be seasonal and is most prevalent in autumn and winter months. Those are the causes. But what do general practitioners look for when diagnosing croup? Well, it's characterized by the acute onset of a barking cough, stridor, which is a creaking or grating noise, hoarse voice, and respiratory distress. This is caused by the inflammation of the trachea and upper airway. 48 hours prior to the acute onset, patients may experience non-specific respiratory indicators. Severity and the duration of symptoms vary from patient to patient. The treatment of croup is reliant on the severity of symptoms. So let's look at the mild to moderate cases first. Mild cases can be treated in a home environment, and patients are encouraged to stay calm in order to ease breathing. General practitioners can prescribe corticosteroids to aid in the treatment of croup. Corticosteroids aim to reduce swelling in the upper airway and thus improve breathing. Patients with severe symptoms may be treated with adrenaline. This is a rapid way of treating croup, with symptoms easing within a 4-hour period. If this fails, hospital admission by ambulance may be required, though only 1.3 to 2.6% of cases result in hospitalization. Caregivers aim to provide the best evidence-based approach to patients. The best approach for this condition is highly dependent on the severity of symptoms from patient to patient. The treatment for moderate to severe cases require the most costly approach. Corticosteroids, in particular inhaled formulations, tend to be quite costly. Furthermore, if ambulance admissions to hospital, along with long hospital stays and interventions are required, this increases costs further. On the other hand, the least costly approach can be taken by mild cases. In cases where symptoms resolve on their own, resting in a home setting has shown to be a successful method. To conclude, croup is a viral infectious disease affecting the upper windpipe of children. There are a number of causes, and the most common being parainfluenza type 1 and 3. Symptoms are characterized as being acute onset of respiratory distress. Symptoms commonly present at night or in the early hours of the morning. Treatment varies between patient to patient depending on the severity of symptoms. General practitioners either prescribe costly intervention methods such as corticosteroids or inexpensive treatments such as resting at home. Severe cases require hospital admission and interventions. Further evidence-based research and knowledge still needs to be developed in relation to croup.